Hello, my name is Dr. Dewan S. Raja. Today I will discuss about pyogenic granuloma, also called lobular capillary hemangioma. What is the definition of pyogenic granuloma? Pyogenic granuloma is a common benign vascular lesion of the skin and mucous membrane. So it is not malignant. It is benign. Despite the name, it is not infectious, not pyogenic or pus producing, nor a true granuloma. Okay, so like some chronic inflammatory cell like lymphocyte macrophages are lacking here. No pus is present here. The dead leukocyte or tissue necrosed tissue or necrosed tissue fluid is lacking here. No pus is here. No dead bacteria is here. It is a lobular proliferation of capillaries, hence the alternative name, lobular capillary hemangioma. What is the epidemiology of pyogenic granuloma? Common in children and young adults. This is the pyogenic granuloma. Frequently seen in pregnant women. Hormonal influence, pregnancy, tumor, both sexes affected, but oral pyogenic granuloma is more common in women. This is the image from Darmnet, pyogenic granuloma. What are the etiology and risk factor? Minor trauma or irritation. There is biting, dental appliances. Hormonal factors, especially in pregnancy. Certain medication, that is retinoid, indinavir, EGFR inhibitor, can arise at sites of chronic irritation. What are the clinical features of pyogenic granuloma or lobular capillary hemangioma? Appearance small, red, fleshy, friable, rapidly growing papule or nodule, size usually less than 1.5 centimeter, surface often ulcerated and bleeds easily with minimal trauma, location, skin, fingers, hand, face and skull, oral cavity, gingiva, lip, tongue. In the tongue, pyogenic granuloma is common during pregnancy, often mistaken for amelanotic melanoma, Kaposi sarcoma, or squamous cell carcinoma. These are also the differential diagnosis. If they are atypical, they resembles pyogenic granuloma. Okay, so we are looking, here is the pyogenic granuloma on the lip, pyogenic granuloma on the lower eyelid here. If we go to the histopathology, lobular arrangement of proliferating capillaries, and certainly the endothelial cells, mixed inflammatory infiltrate, edematous stroma, ulceration of the surface epithelium, often present, diagnosis, clinical appearance, often suggestive, biopsy excision needed to confirm, to rule out malignancy. So this is the histopathological images. If you go there, here is the lobular pattern of the capillaries. Then the stroma, edematous stroma, contain inflammatory cell. So endothelial cell clusters, inflammation, mitosis of the endothelial cells, edema, and this is the capillary lumen containing RBC here. These are the capillary lumens. We may have ulcer on the surface, discontinuity of the epithelium on the surface of the pyoderma granulosa. Treatment, if it is benign, this is benign growth. It bleeds easily, recurs if incompletely removed. Indication, cosmetic, bleeding, irritation, and we must rule out malignancy because we have some differential diagnosis like amelanotic melanoma, okay, like that. So we must rule out malignancy. Conservative treatment, observation, topical timolol, that is a beta blocker. Imiquimod, this is also for immunosuppression, clobetasol, and silver nitrate. These are the topical choices. Okay, procedural, mainstay treatment, shave excision plus cautery or full excision with histopathology, curettage, cryotherapy, laser therapy. Special treatment may regress in special situation. It may regress in pregnancy, recurrence if base not destroyed. Pyogenic granuloma, lobular capillary hemangioma, prognosis, benign, no malignant potential, may recur particularly if incompletely excised. And that's all about pyogenic granuloma. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.